Has someone told you that you have eczema and you're wondering, so what the heck does that actually mean? Hi, I'm board-certified dermatologist and skin wellness expert Dr. Cynthia Bailey, and I'm going to explain eczema. Eczema is actually a fairly broad term. It's not a specific diagnosis. So, eczema really means a rash that's going on in the skin, and it applies to a variety of different types of rashes. In eczema, you have inflammation of this top layer and inflammation down below. There's a whole bunch of white blood cells down here, and up here, the inflammation is actually causing the cells to separate, and we call that spongiosis. So the cells are kind of stretching and coming apart a little bit. And in that space, you now have a disruption of the skin barrier that creates one of the common problems in eczema, and that is that your skin is now extra sensitive. So the cells here are stretching apart and things get into the skin more readily. In addition, your body's waters get out more readily. So you have a barrier compromise to your skin when you have eczema. No matter what the cause of your eczema, that barrier compromise is there, and healing it is really important. So first I'm going to talk about the common different types of eczema, because if someone's told you that you have eczema, you probably have one of these common types of eczema. The first type of eczema, that's the classic form of eczema we think about when someone says they have eczema, is atopic dermatitis. Atopic dermatitis is a genetic condition that people are sometimes born predisposed to. And with atopic dermatitis, the rash may start in childhood. It often starts in what we call the flexural areas, the folds of the elbows behind the knees, but the entire skin surface can be involved in eczema, including the face, the arms, the legs, the trunk, etc. People with atopic dermatitis also have immune dysregulation, immune issues with their skin, and their skin is very, very sensitive. They're prone to being allergic to things that touch their skin. They're also sometimes prone to also having asthma and hay fever. So asthma, eczema, hay fever often are called the atopic triad, and they travel together. So if there's asthma, eczema, or hay fever in your family, atopic dermatitis may be something that you're predisposed to. People with atopic dermatitis have classic sensitive skin, and they need to think hypoallergenic skincare, hypoallergenic lifestyle, hypoallergenic personal care products, because their immune system in the skin is hyperactive and prone to becoming allergic to any number of things, fragrances, preservatives in skincare products, etc. The next kind of eczema that's common is dry skin eczema, also called nummular eczema or osteototic eczema. Nummular implies coin-shaped, and you get round coin-shaped patches of eczema, usually on the arms and legs. Osteototic eczema, the term osteototic implies there's sort of a cracking, a dry cracking to the skin. Usually you see that first on your shins, and the skin starts to look like the bottom of a dried lake bed. This kind of eczema happens more as we age, and it's because the skin has become so dry that inflammation has developed, spongiosis has occurred, and there's now a disruption in the skin barrier. Another kind of common eczema is seborrheic dermatitis. Seborrheic dermatitis is a form of eczema due to seborrhea. Seborrhea is actually dandruff. So you can have scalp eczema from seborrheic dermatitis. You can have face eczema from seborrheic dermatitis. The cause is slightly different. We don't entirely know the cause of it, but we do know that pityrisporum yeast plays a role. But again, there's inflammation here, a disruption of the skin barrier, and the skin is very sensitive. Things easily irritate the skin affected by seborrheic dermatitis because they go in and they're harsh. Another common type of eczema is allergic contact dermatitis. So you know allergic contact dermatitis as poison oak and poison ivy, but you can also be allergic to ingredients in skincare products, for example, fragrance in shampoos, preservatives in shampoos, metal for nickel dermatitis. There are many things that you can be allergic to and that cause inflammation in the skin, spongiosis in the epidermis, and a disruption of the integrity of your skin's barrier. Another form of eczema is irritant dermatitis. Irritant dermatitis is where your skin comes into contact with something that's so harsh that it actually breaks your skin's barrier down and causes inflammation. So the harsh substance comes into contact with your skin, breaks down the structural integrity of your skin, and then your skin mounts an inflammatory or immune response. Insult happened from the outside, but the end result is eczema. So think of harsh solvents, paint thinners, harsh dishwashing soaps. Those are the sort of things that will cause irritant dermatitis. Chapping wind and weather can cause irritant dermatitis as well. Another kind of eczema is eyelid dermatitis. The eyelid skin is very, very thin and a canary in the mine shaft when it comes to allergic reactions or irritant reactions to substances that touch your skin. So think acne products that are sometimes tolerable to the rest of your face, but your eyelids start to get a little bit dry and or stingy. Allergens like fragrances and preservatives washing over your face from your shampoo or hair care products. Substances carried up that your hands can tolerate because that skin's very thick. But you rub your eyes and you're bringing the substance up to your eyelids. Heck, I had one patient, he was allergic to the nickel on his saxophone. He could tolerate touching the saxophone with his hands, but he would rub his eyes periodically and he was carrying the nickel up from his saxophone and getting an eyelid dermatitis. So eyelid dermatitis is a form of eczema that manifests on the very thin skin of the eyelids, either in the crease or on the whole eyelid itself, either bilaterally or unilaterally. Another kind of eczema is stasis dermatitis. Stasis dermatitis happens because of insufficient circulation on your lower extremities, meaning the shins, lower legs. And because of that insufficient circulation, the skin down there is vulnerable and prone to breaking out in eczema. And that eczema is really important because number one, once the circulation's bad, it stays bad. And number two, once the eczema occurs here and there's a break in the skin barrier integrity, infection can occur. And that infection can be very serious. And the last common type of eczema that I want to mention is called dyshidrotic eczema. And that's this weird, we don't understand it, hand rash that people get with stingy, itchy blisters that form on the lateral aspects of the fingers and the hands that can ultimately fissure and cause painful cracks. And the hand skin takes a really long time to heal because it's so thick and we use it every day to touch things and to wash dishes, and we get it into harsh solvents, etc. And so dyshidrotic eczema is a troubling form of eczema that requires a long-term care strategy to heal. And that brings me to what do you do if you have a diagnosis of eczema? So I told you in the beginning, the common problem with the skin is that the barrier is compromised. And so you need to use skincare that allows your barrier to heal. In addition, while the barrier is compromised, you need to use hypoallergenic and gentle products so that you don't add or introduce irritation into the skin with things that are harsh or provoke allergies because stuff gets through your broken barrier. So what do I mean by hydrating and gentle skincare that will allow your eczema to heal? Well, there's three basic principles to that. First, pick a soap that's not harsh. You don't want to continue to strip and damage the components of your skin's barrier, which are lipids and proteins. So you want to pick a mild soap and use it sparingly when you cleanse your skin. You want to use coolish water because hot water is going to strip the natural oils in your skin and further damage the eczema-prone skin. In addition, hot water is going to bring circulation into the skin and cause your skin to be red. And with that increased circulation and that redness comes more, we call them inflammatory mediators, the building blocks of this rash, and it's going to just rev the whole thing up. When you use cool water, you actually constrict your vessels and you help wash away the mediators of inflammation so that your skin can heal. And the third principle of healing eczema is to immediately moisturize your skin after you've toweled dry. So when you're washing your skin, you're exposing it to water, it's soaking it up, and that water is going to help the skin heal. You want to trap it by putting a moisturizer on top so that the water doesn't further evaporate. Your skin will love you even more if you use a moisturizer with some natural oils that will help your skin to heal and to lock in water throughout the layers of the skin. So, what are the best cleansers for healing eczema? Well, you have a couple choices. First, with whatever choice you make, it needs to be hypoallergenic. So that means not a lot of fragrance and not a lot of harsh preservatives. Then within that criteria, you can choose natural cleansers or pH-balanced synthetic cleansers. So the natural cleansers, without fragrances, without botanical essences, without a whole lot of potential allergens, are just simple soaps, ideally created from oils. The saponification process takes oils and turns them into soap and glycerin. So ideally you want the glycerin in there as well, because the glycerin is going to help hold water to your skin. It acts like a sponge. Alternatively, you can use what are called syndits, synthetic detergents, and they're pH balanced soap alternatives for cleansing. And they're the classic dermatologic products that you'll see Dermatologist approved, and they tend to look a little dermatologic. What are the best moisturizers to heal eczema? Well, ideally you want rich moisturizers, and again, they have to be hypoallergenic. So you want to avoid fragrances, you want to avoid a lot of other stuff in there. The process of creating creams and moisturizers often involves an ingredient list that's occasionally mind-boggling and looks like it needed a PhD in chemistry to create. You want to keep it simple, and you don't want a lot of fancy fragrances and botanical essences, because those are going to become allergens. So just simple moisturizers made with botanical oils that are hypoallergenic are good choices. You can just go straight to the oils themselves. Those are good for night application because occasionally it's a little too shiny during the day. Or you can use, again, just a classic dermatologic preparation here that's hypoallergenic and designed for eczema-prone sensitive skin. And or cosmetically elegant products, again, that are hypoallergenic and designed for sensitive skin. So what other important points do you need to know if you're prone to eczema? As I mentioned with your skincare products, you need for them to be hypoallergenic, but you need the other products that you use in your life to be hypoallergenic as well. So where are some of the common allergens that I see impacting the eczema of my patients? Well, they're home cleaning products. If you're, cleaning your surfaces with a product that contains allergens or that's irritating, it's going to make your hand eczema worse. If you're spraying a home care product to clean your bathroom, to clean your house, airborne droplets are touching your face, leading to eyelid dermatitis, facial eczema, and or eczema on your hands. And laundry care. I can't tell you how many people come in with laundry dermatitis, which is a form of eczema from an allergic reaction to laundry detergent residue and or the anti-static dryer sheets and the fragrances that are made into those. They develop eczema in the areas where the clothes are held close to their skin. So if you're prone to eczema or have been given a diagnosis of eczema, you want to think hypoallergenic personal care products. So whether they're products that you're putting on your skin, that are washing over your skin from your hair care routine, that you're using to clean your home, or that you're using to wash your clothes, you want them to be hypoallergenic, meaning fragrance-free and not a lot of fancy ingredients, especially preservatives. So I hope that helps. If you've been given a diagnosis of eczema, I hope it helps to explain to you what's going on in your skin, why your skin is so sensitive, how you can help your skin heal, and what you can do to prevent the eczema from getting worse, not healing, or coming back. So thank you so much for listening. If you found this helpful, I appreciate a thumbs up. If you know someone who's been given a diagnosis of eczema and is struggling to understand it or to heal their skin, please share this. And if you have any stories about your eczema or remedies that you found helpful, I'd love to hear them in the comments. Thank you so much. Bye-bye.